How's it going, guys? My name is Alejandro, right here from Bari Klinik. And right here with me, I have Miss Tanya. Miss Tanya was a previous patient from ours, where she got her surgery done almost about a year ago. So we're just gonna do a really quick checkup to see how she's doing. Pretty much 1 year post-op. And Miss Tanya, I was wondering if you could just introduce yourself, like your background, where you're from, and what surgery you
have. Okay, thank you. Hi, Alex. Nice to talk to you guys again. Let me introduce myself. My name is Tanya Yanez. I am actually living in Las Vegas, Nevada for the last 8 years. I was in LA for about 23 years before I came to Las Vegas.
Awesome, wonderful. So I mean, thank you so much for painting a picture as to where you're from. My first question would be, when did you begin looking for a weight loss surgery?
That is a very good question, Alex. When I began looking for a weight loss surgery, it was actually in 2009, and I did have a lap band placed in 2009 in Tijuana, Mexico as well. And it was successful for a number of years. I did lose 75 pounds, but after a while, you tend to understand how to trick the lap band because it is not a permanent procedure.
So yeah, in your case, I do recall that Dr. Moreno performed a revision surgery from a lap band to a sleeve. So definitely that helps out patients to lose weight once again. And I'm just curious to know, how was the whole process of looking for a revision surgery or a second round weight loss surgery from your end, pretty much?
Looking for a revision surgery was actually a grueling process, and I did contact many of the doctors in Mexico because a lot of them had prerequisites I had to meet, or some of them would not do a revision like Dr. Moreno did, which I'm grateful for. They wanted me to have the lap band removed prior to my surgery, which was kind of like, why would I have two surgeries? That's kind of ridiculous. But as I looked into and vetted a lot of surgeons in Mexico, yourself, Alex, and Dr. Moreno answered all the questions that I had. And basically, I read all the reviews and I looked into you guys extensively, not to mention the customer service.
Wonderful. So yeah, I mean, thank you so much for sharing this. I mean, the search process, doing research and so on, it's really important. I mean, definitely many patients, they go back and forth with places. They compare lots of different places as well. So definitely there's a lot of really good competition right here in the city, which I'm also grateful for, because that pushes us to go above and beyond in what we offer. So again, thank you so much for sharing a little bit as to how the whole process was when researching us, or pretty much every other place that we were considering. Pretty much essentially, when you said yes, you said customer service was wonderful. What made you decide, like, what's the one thing that made you decide on us, pretty much?
The one thing that made me decide on going with Dr. Moreno and with Bari was the fact that my medical needs were questioned. Everything that I wanted to have done at one time. Yourself, Alex, took all of my questions and actually spoke with Dr. Moreno and came back to talk to me about the options that I had. And at that point, I realized it was not about the money for you guys. It was about the patients and the care that we would receive and the surgery process that I was asking for. You needed to make sure that I could undergo it and that it would be successful for me. That was my breaking point on choosing your location and your doctor.
And pretty much, Ms. Tanya, going to the point where you say yes, how was the whole preparation before the surgery? I mean, how did you go about that?
I'm really glad that you asked that question about preparation for surgery, Alex, because when I was vetting the other doctors and speaking to the other doctors, they were giving me their prerequisitions before I was to have my surgery. And the one that Dr. Moreno had and that you provided me was actually more reasonable to be able to achieve the goals that I needed to do to prepare myself physically and mentally for surgery. So I was able to choose as well to go with Dr. Moreno because of the fact that you guys have the rules and regulations printed out for us. You tell us what we need, the tools we need, how much we need, and what we need to do to be successful.
Wonderful. So yeah, definitely. We try and make the whole preparation as easy as possible. And mainly it's a pre-operational diet because it can be confusing at times. And at many times people ask me, hey, is this like a full-on 1 month liquid diet? Well, not necessarily. I mean, it may be depending on a case-by-case basis, but usually it's not like that extreme per se. So yeah, I mean, thank you so much for sharing like your whole preparation before the surgery. And going towards the surgery, towards your stay, what was your whole experience like? Pretty much, I mean, did it meet your expectations? What was different? And pretty much, how does this compare to when you first had your lap band placed?
Well, the process that I went through to talk about how we were going to go about getting me from California to Mexico was very smooth. It was explained to me that I was going to be picked up at a designated location. The drivers and yourself were in contact with me at all times, sent me pictures of what they looked like to make me feel secure. Being able to be picked up in San Diego and taken to the hospital and not have to worry about taking taxis, taking buses, getting to and from was a very easy process for me. When I did get my lap band done, I had to make my own way down to the hospital. I had to take taxis. At that time, I was not as fluent in Spanish as I am now, so it was a lot more difficult. And even for people that don't speak Spanish, your drivers, they are very courteous. They speak English. They write you in English on your WhatsApp. When they call you, they speak to you in English. So I know a lot of people are deterred from going to Mexico for these kinds of surgeries because they feel there's a language barrier. But with the Bari Klinik, there is not a language barrier at all. And the process was smooth, and I would actually do it again.
Wonderful. So yeah, I mean, thank you so much for sharing this again. I mean, this is pretty much important to us because it's the first aspect of your whole package when you actually arrive towards getting your surgery. Regarding your stay at the hospital, so normally we keep patients for 3.5 days, basically 4 days, 3 nights. What can you tell me about that process? Getting your surgery done, getting your pre-op work. How was that whole process for you?
The process of having the pre-op done was amazing. Everything was explained to me. Once the driver dropped myself and my companion off at the hospital, from reception, then taking me out to my room, every aspect was explained to me. I was had my labs done, my EKGs done. I was told in detail of what was going to happen, how they were preparing me the night before. Even though I wasn't having surgery till the morning, we go there and stay the night before so we can be there, early in the morning for Dr. Moreno to come in. They had me, they body prepped me. And then in the morning before surgery, Dr. Moreno came in and spoke with me and sat down and talked to me, which is normally unheard of. In some situations, you just go straight from your room to the operating room and you hardly even see the doctor. Once I met with Dr. Moreno in the my room of my hospital, he also met me in the hallway before I was taken into the room, and he explained to me that they were going to put the anesthesia. I was going to be out for X amount of time. He explained to me again every procedure that I was going to have done because I had a few procedures done at the same time. And made sure that I was going to understand everything that was going to be done. And while I was in recovery, he went and spoke to my companion and told them everything that had happened. Again, language barrier is not a problem, as my friend did not speak any Spanish at all. So being able to do a full English for your patients and in Spanish is really a plus. The whole thing was quick. Recovery was not even 2 hours. I was up in my room. You had already come back in, Alex, to check on me, make sure I was doing my lung treatments. And I was told that when it was time for me to get up and walk, because you guys also make sure that your patients aren't up walking too soon because of the effects of anesthesia. So you do care that we need to get up and walk, but it's very important that we don't walk too soon because of anesthesia. So to me, the process was really amazing.
Awesome. So I'm really happy to hear that. That your experience, was really, really good. I mean, that's what we ultimately aim for in offering this like all-inclusive package for you, the patient. Yeah, definitely. Patients usually undergo a process of post-operation care. This includes walking, basically because potentially some side effects might happen, like being bloated with gas, maybe some nausea, dizziness, here and there. But definitely, I mean, I do recall you doing a really good job as a post-op care. So what can you tell me as well, one day after the surgery, getting your second leak test done and getting your nutritional consultation as well?
That is a good question, because the next day is a hard day because of the fact that you are not wanting to drink anything and not wanting to actually move because you're afraid you just had surgery. However, the nurses and the doctors that were taking care of me after Dr. Moreno had done the surgery, they explained everything to me. They took me down to the leak test and they told me that they understood that it's going to be a little hard for a moment for me to drink the liquid, but how important it is to be able to know if I have a leak or not, because Dr. Moreno was on call waiting to see if he needed to take care of anything. And the fact that you actually come in as well, Alex, when your patients are there going through these procedures and aftercare is important to us. They came and picked me up. They explained to me and my companion what they were going to do. They took me down very quickly. They did the test. They waited for the result before they took me back to my room and made me aware that I was okay and reassured me that everything's going to be fine. Took me back to my room, and then they, explained to me how important it is to walk because of, like you said, there could be trapped gas. Plus, it helps with your healing for you to be able to get up and move. So to me, like I said, the process to me was very well-rounded. Everybody is there helping and you have 2 nurses coming in and check on you every hour and make sure that you're doing well, that your pain level is good, that you're drinking your fluids, which is really hard for us. But it's also an important part to make sure that we are doing well with our leakage and also being able to hold down liquids before we're released from the hospital.
Exactly. So thank you so much for sharing this. And definitely, a key aspect in all of this is companionship. So yes, you're gonna have the surgeon go to your room specifically before the surgery, nursing staff going back to your room, double checking that everything's okay. You see my face twice every day just to make sure that you're doing okay. And if things are not like to your liking, I mean, I go ahead and do things to make sure that it's to your liking, basically. I mean, that's why I usually go there. Plus, as well, I get to know you a little bit better, and pretty much make sure that the whole process goes as smooth as possible for you, the patient, because transitioning, that's where I think it's the difficult part here. Of course, your first transition was like getting to come over to get your surgery done. Second transition, pretty much you leaving the hospital, and pretty much afterwards, the transition is usually seen with the nutritionist, but as well, you see that transition going on as you progress, with both weight loss, with both the way that you eat. So definitely, it's really important, pretty much. So talking about after the surgery, back in your life, how was the whole process in this year, pretty much? I mean, this close to almost a year of getting your surgery done. What did you see the first month, the first 3 months, and all the way up until now?
Well, I actually forgot to answer one of your questions a minute ago about the nutritionist. So Norma wasn't her name when I was there, and she did come in and explain everything to me. One good thing as well that she did for me that I followed to a T is that she shared with me a plan of what I'm supposed to eat day after surgery up until now and forever. And it has day 1 to day 10 or 12 or whatever it is. And that was a very important part of my success. So me in the last year, I took those instructions that I received from the nutritionist, and I followed them. Everything that they told me to eat, I would. The cream soups, the yogurts, I would do as best I can. And also Norma would check on me within those first 3 months to see how I was doing. Is it an easy process for a person? No, it's not. But it's something that if you mentally prepare yourself for, the physical is going to be a life-changing thing. The mental is always going to be there because as an obese person myself, changing my portion size before surgery was nothing that I could do, apparently, because that's why I needed to have surgery for myself personally. But following the nutrition plan that was laid out to me, it was literally no thought of what I had to do on a daily basis. Whereas there are other people that I've talked to that had this experience and they didn't get any kind of guidance from their doctors, from their nutritionist, from their patient coordinator like you, Alex. And they were lost on what to eat. And that's why they've regained weight so fast. I've also been talked to about a reset if I needed to. So if I, as a person, fall off the wagon and I indulge, like Thanksgiving just happened, I did not, because I know as a person I was ready mentally for this journey. But I always have the instructions given to me from Bari Klinik. It is not something that they give to me until my probation period on their plan is done. No. I've had many conversations with you, Alex, even after my surgery up until 1 year. I've talked to Norma, the nutritionist, since then with concerns. I've emailed Dr. Moreno and I've gotten answers. So I'm really glad that I made the choice to go with Bari Klinik because, as you have seen on Facebook and other social medias, I recommend you guys all the time because I would go and do the surgery again a million times if I had to because of the amount of preparation that you give us. You set us up for success and not failure.
I want to thank you so much for the kind words. Definitely. We want you to be successful because definitely, of course, it's a process. The ultimate goal for this surgery is not to just come and get the surgery done, get a service fulfilled, but rather the result that comes as a consequence. So definitely surgery plays an important role, but ultimately it boils down as to how you approach this whole process. Surgeries can be done like at any place, but ultimately, again, those tiny differences are going to make a huge impact on your overall process and overall results, essentially. And speaking of results, so when you came in, your BMI stood roughly at about 40.44. Roughly, if I recall correctly, you were at 290 pounds. And you're tall, by the way. You're 5'11". So yeah, I mean that placed you pretty much at a 40.44 more or less. Currently, how much do you weigh?
I weigh 191 pounds.
Wow, amazing. So yeah, so 99 pounds, almost 100 pounds. If we do a really quick exercise right here, give me 1 sec. So basically, your BMI right now should be somewhere around 26.6, which is wonderful. Pretty much, you're no longer in the obese category. So congrats on that. So normally, patients that get revision surgeries usually lose weight a little bit slower compared to first-time surgery patients. However, in your case, in 1 year, you were able to lose a really big amount of weight, a huge amount of weight. And this doesn't mean that revision surgery patients don't lose like the same weight. It's just that it takes a little bit longer. But ultimately, in a 1 year gap, you lost a really good amount of weight. So just doing a really quick calculation on the top of my head, you lost about 14 BMI points. So in that regard, congratulations. Definitely, I would push you to keep on pursuing a little more weight loss. You're 1 BMI point away from being quote unquote on the regular BMI range. But of course, I mean, this is different. If you have a lot of muscle, okay, no worries. I mean, it's okay if your BMI is a little bit like on the like 25 plus. But yeah, I mean, we want to make sure that you have healthy weight. And definitely, I'm just so I'm so amazed at the results that you've gotten from this whole process. I'm really happy for you as well. And moreover, I'm happy that I was able to be a factor in this whole process. Ultimately, it boils down to you. I mean, both Dr. Moreno, the hospital, myself, our marketing team right here as well. We are like pieces of the puzzle. We help you out, but ultimately it's essentially you, the patient, that generates like this end result. And hopefully it doesn't stay like this. Hopefully you can keep pushing forward. I mean, after that 1 year gap, because that's going to be a really, really important factor as to making this result a long-lasting result. It doesn't need to be like sacrificing good meals, like avoiding food, but it's just a matter of eating right, eating smart, and coping with this throughout your daily life. And that's essentially where you see the best result possible. All right.
I agree. Thank you very much. And a result of that as well, Alex, just really quick, is because of the meal plan that you guys provide, it gives people like me that use food as rewards, use food for depression, for sadness, for happiness. It gave me a guidance on exactly what to do to be able to reach my goal. And I still have some more to do, but like you said, I'm almost 1 year out. I've passed a bunch of holidays, so it hasn't been as hard as I thought it was going to be, because I remember that I did this for me and my health and my future. And I really appreciate that you guys were there to help me.
Amazing. So essentially, I want to thank you as well for trusting this whole process. I mean, from the minute that you got in touch with us, getting to know us as well, and for giving us the opportunity in helping you out to meet your health and weight goals as well.
I would just like to say to anybody that is thinking about or even just has a small idea of getting surgery with Dr. Moreno in Mexico, I would 100% recommend it. There is no reason to be afraid to go to Mexico. I know there's a lot of people that say it's a bad thing. It is actually a very good thing. They treat you like royalty. They treat you like they care. You are not just an insurance payment to them. Yes, I understand that we do have to pay out of our pockets because our insurance does not cover it. But the amount of care that you get for the cost and the amount of aftercare is well worth it. They pick you up in a safe location. They take you directly to where you need to go. They take you and your companion, if you take one, back to your safe place. There is no reason to be afraid to go to Mexico. Their medicine is just as good, or if not even more technologically up to date than what we have in the United States. I have spoken to so many doctors in the United States. There's so much political bureaucracy, insurance payments, that all they want is their money. When you go to a doctor like Dr. Moreno and with Alex as a patient coordinator, they treat you as a person, not a piece of meat, not a paycheck. I would recommend anybody to go and do this in Mexico. And I would do it again if I needed to in the future. And I am so glad that it is one of the best decisions that I've made for my health, for my children's future, and my future. If you are thinking about it, just do it. It's your life that you're thinking about. You have such a future ahead of you, and you can do this. And you need Dr. Moreno's help.
So, Tanya,
Yes.
it was my pleasure having you here as well. I know that we haven't seen each other like face to face physically, but at least like virtually, I'm able to see how your whole process, what the whole process has yielded in your case. So yeah, I'm really happy to see this whole transformation. And of course, we're gonna aim to help more people out. And I want to thank you. Really give you a huge thanks for doing this, because definitely this helps us reach more people. This helps us confirm that we're doing the right thing regarding helping people out. And I'm so happy to see that. I mean, you're happy with the whole process. And of course, if you ever have any questions, any other kind of inquiries of any kind, we're always right here. One message away, one phone call away as well.